Hello everyone and welcome to my YouTube channel. I go by Derek Javier. I am a certified nursing assistant, or CNA for short. So today I'll be talking about what a CNA is and does and how to become one and how much CNAs make and where they work. So let's get started. What is a CNA? Who are certified nursing assistants? So what I'll be covering today are job roles, job responsibilities, education and training, certification, types of CNAs, places of employment, and wages. Job roles and responsibilities. What CNAs do. What do CNAs do in their line of work? So CNAs do a lot of various types of things throughout their shifts and in respective to their job title. So some of the things that CNAs will do, or they're responsible for, are to bathe and dress patients, or residents in this case, serve meals, help residents with their dining needs. They will take vital signs for the nurses. They will also, help to turn and reposition residents that are bedridden. So generally every 2 hours, residents need to be turned if they are not able to do so themselves. Um, what we're also responsible for as CNAs is to provide toileting needs. So if they need to use the bathroom, we will assist them in the bathroom. If they use a bedpan, we'll also provide assistance for that. We transfer patients from their beds to their wheelchair to their bed, to the toilet, and that is something that's very common when you work as a CNA throughout the shift and throughout the day. Is you'll be doing a lot of transferring. Another thing is you will answer their call lights, preferably under 5 minutes or so, because a lot of facilities um, have a standard. Some say, a call it must be answered in 15 minutes or less, 10 minutes or less, but at a facility I used to work at, they were very firm and strict about us answering call outs in under 5 minutes. So depending on the facility you work for, or yes, depending on the facility you work for, there may be a time limit. And you're also responsible for cleaning and making sure that a lot of the areas that residents come into contact, or where they're at, are properly cleaned and disinfected. You're also responsible for changing their bed linens. So, like, for example, their sheet, top sheet, blanket, draw sheet, bed pads, those types of items. And the most important thing, well, not the most important thing, but one of the most important things that you will do as a CNA is that you are the eyes, um, ears, nose for the nurses, because as a CNA, you will be the one that is in contact the most with these residents. You will be the first to know their changes, in their mental state, their emotional state, their physical well-being. Do they have skin tears? Are they having skin breakdown? Are they starting to get red in certain areas? Do they have a rash? You'll be the first to know all that, because you interact with them very frequently and on a much more frequent basis than the nurses do. What is scope of practice, or SOP? Scope of practice basically is what you can and cannot do as a CNA. So you do not ever want to go outside of your scope of practice. For example, an, uh, an item that is out of our scope of practice would be starting IV drips. You do not want to be caught doing any of that, you will get in some serious trouble for that. Another thing is performing feeding tube, starting feeding tubes. Those are out of our scope. Performing trach care. You do not ever want to disconnect a trach or clean a trach. That is a nurse's responsibility. You also, as a CNA, are not allowed to perform catheterizations or to perform blood draws unless you are also a certified phlebotomist. But in most cases, and in most cases, you will not be doing any blood draws because CNAs are not trained to do that unless they receive education and training outside of their CNA license. Overall, you do not want to be caught doing anything under your scope of practice because that can land you some serious trouble, not only with your facility but also with your state, um, because that is grounds for losing your license, and you do not want to lose your state licensure because you put in a lot of hard work and a lot of money into your CNA course and your CNA learning and in the in in obtaining your CNA license. So you do not want to jeopardize any of that. So I always strongly suggest that you get in contact with your supervisor, your company policy, what your facility expects of you, and what you're, to verify what you are allowed to do and what you're not allowed to do. Because the last thing you want to do is to be engaged and be participating in something that will have your license revoked and ultimately taken away, because in some cases, some people have performed things outside of their scope of practice and they have lost their licenses for life. They are not allowed to ever work as a certified nursing assistant again, and they are not allowed to work ever as an RN, as an LPN, or LVN in any healthcare professional sense where patient care is given. So please stay in your scope of practice. I do not ever advise anyone to go out of their scope of practice, and if a supervisor, a nurse, anyone is asking you to go outside your scope of practice, politely decline and immediately let your supervisor know. And if it is your supervisor that is the one telling you to do so, immediately go up the chain of command, because you are not allowed to ever go out of your scope of practice. Does place of work affect a CNA's responsibilities? Yes, depending if you're working in long-term care, if you're working in an acute care setting, like for example in a hospital or a dialysis center or in a home care setting, your job roles and responsibilities will vary, but to a core extent, they will be all the same because you're responsible for their well-being, you're responsible for a lot of similar job roles and responsibilities. For example, toileting, bathing, your basic everyday necessities as a human being. You will encounter that regardless of your place of work. But to answer the question, yes, it will vary depending on where you work. Are CNA responsibilities the same in all states? Again, to an extent, yes. I would say the core is practically the same, but if we're talking about your scope of practice, there will be some differences in the scope of practice for a CNA in every state in the United States. So, for example, Arizona's may not be the same as Vermont's, Florida's may not be the same as California's, Idaho's may not be the same as New Mexico, Colorado may not be the same as Utah, um, Alabama may not be the same as Tennessee. So you have to get familiarized with your state's scope of practice because you do not want to jeopardize anything. You don't want to be engaged in anything. Um, so always read up on your state's scope of practice and what you're allowed to do as a certified nursing assistant in your state. The next popular question that I get all asked a lot, or all the time rather, is should I become a CNA? It depends. Um, there are a lot of people that go into this profession for the wrong reasons. Um, they want to go into it because they don't want to be working in the fast food industry or a low paying job, for example, like housekeeping or any of those. And that's not a bad thing. But if you're solely in it for the money and have no compassion, no patience, and no regard for the human condition, being respectful of that person that is in your care, then I think you should strongly reconsider going into this field. Because in my experience as a CNA, I've been a CNA for nearly a decade. I'm I'm almost at my 8th year of being a CNA, and in my experience, a lot of people go into this career for the wrong reasons, and it shows who who's in this career for the right reasons. The best CNAs are the ones that are compassionate, that are patient, that are very professional on top of that, and they get along with their residents very well, their supervisors, their coworkers. Those are the best CNAs. Ones that are willing to be team players, they don't mind helping you, they don't mind going the extra step, because this career will require you to go beyond the minimum. If you're not willing to go past giving the minimum amount, then I say strongly reconsider and find something where you can get by doing the minimum, because this job will not allow you to scrape by. Should you scrape by, your residents, your patients, your clients are suffering. Their care suffers. And it is because of them that we have a job. And if that cannot be taken seriously, then this may not be the career for you. I am very much involved in the care of all of my residents, my clients, my patients, and I take patient care very seriously. It is not something to play around with. I am very professional. I act accordingly, and I just, to put it plainly, I take patient care very seriously, and I think that if anyone is not willing to take their role as a healthcare professional seriously, then they're in the wrong career. And they're even more in the wrong career if they're not willing to be compassionate, good-hearted, kind, respectful, and and professional all at the same time. Then they're definitely not in the right career, because this career will stress you. It will push you beyond your limits sometimes, emotionally and mentally and physically. And you have to be professional in that you keep your cool and that you don't blow a head gasket at every minor situation, because this job will test your patience. And again, if you're short fused and don't have the patience, this is definitely not the job for you. So I stress that you reconsider if that's the type of person you are. Education and training, the road to becoming a CNA, there are different avenues. So one of the most popular route I would think is the college and university route. So basically, like your local community college, your local university, a vocational school or tech school. Those are the most popular, I think. And then the second most popular is in facility training. So, for example, you get hired on as a non certified nursing assistant, as a nursing aide, or a resident aide, or resident assistant. There are many different titles for this, and you will have that title until you've passed the CNA class at your facility or agency. Um, and when you pass your state exam, you will be moved up to certified nursing assistant. And generally, long-term care facilities are the ones that hold these classes, these in-facility classes. Rarely is it ever in a assisted living, and rarely is it in home care agency, but in home care agencies. But should it be available, I would jump on the opportunity. There are also other sites. Other sites could be like, for example, a company or agency outside of those three that I just mentioned that are willing to train CNAs. So, for example, like Red Cross often has um, CNA training courses. Other agencies like that, other companies like that will offer CNA training. Um, you just have to find out what avenue is best for you, way, what route is best for you. For example, someone that wants to have a more classroom-like setting might find it best to be in a college, community college classroom setting. Some people want to basically essentially get on the job training, which is what you would get in facility um, CNA courses. You'll be working as an NA, as a nurse aide. You won't be certified, working alongside a certified nursing assistant. NAs are not allowed to work by themselves, alone, without a CNA. They must always have a CNA present. And some people may find that those two avenues might be for them. It all depends on your personal preference and how you learn. So those are the ways to become a CNA. Road to certification. So basically, if you're seeing this timeline, just to quickly run through it, first you find a state-approved CNA class or course, and after a certain amount of time, after you've done your classroom work, your lab work, you finally are able to attend clinicals at a state-approved long-term facility. And always make sure that it is state-approved. You also want to get your proctored state licensing exam scheduled, and that is at a state approved testing site. Always verify that it is at a state approved testing site, because the worst thing that you do not want to happen is to have your scheduled license exam and it's not at a state approved site. So always verify those two things. And in the meantime, prepare for your state licensure exam once you know the date. Prepare for it. Practice on family, friends, anyone. Utilize your resources. So if you know a nurse, a fellow CNA, um, um, someone in the community that is either one of those titles, they will be your biggest asset. And for example, let's say you pass, you can begin working for a CNA. You'll be in the in your state's CNA registry. Every state has a CNA registry. Um, Begin looking for work. Let them know I just passed my exam. I'm state certified. I don't have my official state certificate yet. So that in the meantime you'll be waiting, but you will be active in the state registry. I believe a week or two after you have passed your state exam. If you did not pass, begin studying, practice more. Again, utilize your resources, use your books, use your textbooks, read over it again, practice on family and friends. You know, ask nurses that you may know. Ask someone you know that may be a certified nursing assistant. They will be your biggest assets. Um, and there are many different types of CNAs that that exists in this industry. Um, the most generic type is a general certified nursing assistant (CNA). They work in long-term care facilities, home care, home health agencies, clinics, hospitals, hospice, and private care. HHA, a home health aide, is a specific type of CNA or caregiver that works in a home health setting. HHAs are sometimes CNAs, but often CNAs go through less trained than CNAs. So there are HHA courses at community colleges, vocational schools, and generally they will go through a similar course outline for for CNAs. They'll follow a similar course outline to CNAs, but they go through less training and they aren't trained in as many areas as CNAs generally. And so if you get hired on by a home health agency or elsewhere, and if you want to apply later at a facility, they may ask you to get your certified nursing assistant license before you can work, or they may hire you on, but they may expect you to get your CNA license at a certain point, or they may be willing to train you, like I had mentioned in the one of the previous slides. So the next one is a PCT. A patient care technician is often a specially trained CNA who typically works in acute care hospital settings. PCTs are often trained to perform catheterizations, IVs, phlebotomy. They are also trained to deal with. I'm trying to think of it now. They're also trained to work in dialysis centers as well, so they can, get people set up for dialysis, and they're trained to sterilize the dialysis machines. So that is another area of work that PCTs work, and they are basically CNAs but with more advanced training. RNAs, a restorative nursing assistant, is a CNA who performs restorative duties and often aligns with and works closely with therapy. An RNA often assists in weighing residents, patients, and performing restorative ambulations. So RNAs work closely with the therapy department in a facility, and they basically help to restore the resident back to how they were previously, or to an extent how they were previously. Again, this is where they would work with different types of therapists. So whether it's an occupational therapist or a physical therapist, they will work closely with the therapy department to help the residents regain some of their mobility. Another type of CNA is an agency CNA. Agency or travel CNAs often work in long-term care facilities. Um, agency CNAs, agency CNAs often work as either per diem or contract employees. So, agency or travel CNAs, basically, both words are used to describe the same type of CNA. They go from different facility to different facilities, and they are able to work as PRN. If you're not familiar with the term per diem, they're pretty exchangeable to mean the same thing. You get to pick your own schedule, work when you want, or work. You don't have to work as often as full timers, but if you want to, that's your choice. Contract, depending on the facility and what their needs are, contracts can vary from 2 weeks to a year. It just depends on the need. Another type of CNA is a hospice aide. They are specially trained in the care of usually terminally ill clients. Hospice aides often work in a home setting, but in long-term care facilities, they will be they will be working for a home care or hospice agency, but they will have clients that are staying in long-term care, so they will work for an agency, go to a long-term care facility to provide one-to-one or one-on-one care, and they can all and hospice aides can also work as private care hospice aides. So that's another avenue for hospice aides as well. Um, an MA or a medication tech or aide is a specially trained CNA that has the role of administering residents their medications. MAs often work in long-term care and assisted living facilities. Those are generally the two most commonplace. I don't believe I've ever seen an MA working in a hospital, and I don't believe I've ever seen an MA working um, in home care under the title MA. It's most usually in long-term care and assisted living facilities. Again, this particular title of CNA is not available in all of the 50 states. For example, in the state of Illinois, they do not have or utilize medication aids. They are not allowed to do that. Only the nurses are allowed to administer medications to the residents, clients, patients. However, in my state utilizes medication aids, and there's CNAs that are specially trained in administering medications. So they must be a CNA in order to become an MA. It is required that they are a CNA and have worked as a CNA for a specified amount of time before they can become a medication tech or a medication aid. The next is a resident assistant or resident aid or RA. They can be CNAs, however, not always. RAs often work in assisted living or independent living facilities and occasionally long-term care facilities. And this is generally also another title that that is given to employees that are nursing assistants who are not certified. So it depends on the facility and where you work. This is usually another term that is given to someone that is working as a nursing assistant but is not certified. So if you're in the in-facility CNA course, you will be working as an RA until you pass the course and pass your state exam. Then you move from being an RA to a CNA. And some places have different titles for this. So, like, for example, at one of the places that I work at, I am a CNA. However, my title is Resident Care Specialist, or RCS. So, depending on the facility and the company, sometimes you may get a different job title. So, for example, with me, I'm an RCS or CNA. So, I'm a Resident Care Specialist. Um, so, you'll have companies and facilities that may call their CNAs something different. But at the very core, they are CNAs, regardless of what the company or the facility decides to call them. You are still seen by the state, by your state, as a certified nursing assistant or certified nurse aide. I prefer the term certified nursing assistant because I feel it sounds more professional and you sound like an actual healthcare professional. But again, that is solely my opinion. Places of work for CNAs are generally in two places, in facilities and at home. So, facilities, CNAs often work in various types of facilities such as acute care, long-term care, clinics, so this can be urgent care or dialysis, etc. But I will say to work as a CNA in an urgent care clinic is rare. And if you are one of the lucky ones that get to work as a CNA in urgent care, consider yourself blessed because those are far and few between and they do not come up very often. For example, I had almost gotten the position as a urgent care CNA. It was about an hour and a half away from where I live, but unfortunately, I didn't get the job because they decided to find someone that was more local to their clinic center. So I cannot blame them for that, but um, urgent care CNAs are rare. So if you do get one, consider yourself blessed. CNAs also work in hospitals and in assisted living, but in assisted living they will go under a different job title, and in assisted living it is not required that you be a CNA to work there, but it is a plus, and often results in getting higher pay than people that aren't CNAs but are working there as resident assistants. So it does have some payoffs most times. So another popular location for CNAs to work is the home setting. CNAs will often perform home care, home health care, or hospice care in the client's home, and I'd say about 99.9% of the time you will be providing one-to-one or one-on-one care, um, for for the client in their home. In rare instances, you may be caring for two people at the same time, but that does not happen very often. So 99% of the time, you will be providing one-to-one care, and where you choose to work is ultimately your decision. What you feel most comfortable with, what you find most enjoyable. I am fortunate enough that I have the ability to work in both facilities and in home care. I am a PRN caregiver for a home care company, so it's nice for me to be able to have that option, because home care is not as physical and it's not as intense as working in a long-term care setting in the hospital, or in a dialysis center. It's not anywhere near the workload. However, that may not be your cup of tea. That may not be where you want to work. So again, it all depends on your personal preference. So for wages, how much will I make? How much will I make as a CNA? It depends. Every state in the country has their own set of ranges. I cannot give you your state's wage range. For my state, it generally varies between, I'd say, 10 to 13.50. Those are the most common pay ranges that I've seen in my state. So, years of experience, what certifications you have, whether you're bilingual, all those come into play also. There are also other variables that come into play. Do some places pay more? Certainly. So depending on your place of work, if you work in assisted living, if you're working in home care, if you're working in a hospital, dialysis, um, you know, those will all make a difference in how much you get paid. And in most instances, you will make more in long-term care and in a hospital than you would in home care. Hospice generally tends to pay more than home care and in home health. So if you want to work in a home care setting, I would strongly recommend that you work in a hospice, unless you don't deem yourself able to work in a hospice setting, because it can be very emotionally taxing. Does where I live affect my wages? Of course. Again, going back to the original question, every state has their own pay range, so geographically, where you live, you may make more. So in the high cost of living areas like Los Angeles, New York City, Miami, um, Seattle, in Dallas, you may make more because the cost of living is higher. So yes, certainly, where you live does affect how much you make. Um, will I make more the longer I'm a CNA? Yes. A lot of places go by, how long you've been a CNA, and the longer you've been a CNA, generally the higher they will pay you. But not always, because there are also other variables that come into play. Like, for example, how many certifications you have, whether you're bilingual, trilingual. For me, I am to an extent trilingual. So I speak English, I speak Navajo, and I speak Spanish. So to an extent, I am trilingual. To an extent, quadrilingual if I say that I can speak some Portuguese and get by. So a lot of places consider a lot of variables, and it depends on where you wish to be hired on at. Every place will look at different variables and will base your pay off of that. Will I get a raise? Again, depends on where you work. Some places may not give raises even if you worked for them for 20 years. They will not give a raise and you're stuck at 1050. Some places will give performance-based raises. So, for example, if you get hired on at a home care agency and you're making $10.50, and in the past 6 months you did not call in and you worked overtime, you filled in shifts, they may say, "Hey, you worked great the past 6 months. We want to give you a performance-based raise. We're gonna boost your pay to $11," and it depends on the facility, on the not facility. It depends on the agency. Sometimes it's 50 cents, sometimes it's less, sometimes it's more. It all depends. Does type of work affect pay also? Yes. So hospice pays more than general home care, and working in a hospital and long-term care will almost always pay more than home care. Again, it's a little bit different if you consider private pay home care. So if it's private home care, you could easily make more than someone doing long-term care, hospital, acute care setting, and working as a caregiver in the home care setting. You could easily make more depending, but it depends on who needs the care and how much they're willing to pay. So in some instances, private pay will pay more than the others. So that concludes my video. I wanted to keep this kind of short because I did not want to overwhelm everyone with too much information. I just wanted to be brief and to the point. This is like my third or fourth take on this video, and so I wanted to be brief and to the point because I have a tendency to kind of go off on a tangent a little bit. So here are the credits. This is where I got where I got the images from, and I know it's not the best bibliography ever, but to get this video out quickly and to you guys, I wanted to do it. So these are the respectful owners and people that have made these images. So I do not own any of that. That is their property. So I just provided the links to them and their respectful owners. I just want to say thank you for watching. Don't forget to subscribe. I am going to continue producing content for you all because I know that CNA content on YouTube is quite rare and scarce a little bit, especially from a male perspective and from a minority perspective. So, I wanted to provide a unique standpoint, a unique point of view, being male, and a minority in this industry. I have a different set of experiences than probably most other people would have, being a minority and being male, which is also another minority in this industry. But anyways, I hope that you all enjoyed the video. Please make suggestions for me to do future videos. I'm going to be producing a lot of content on, like what it's like to be an agency CNA, what it's like to be in home care, are some good interviewing tips and everything like that. So how to land that perfect CNA job, what to do right after you finished and passed your state licensing exam. I'm going to provide future videos on those. So, but again, thank you all for watching and don't forget to subscribe. So, thank you, and I hope that you learned something new. Have a good day.